This is an example of a child with social withdrawal and bizarre beliefs. A child with social withdrawal and bizarre beliefs. A mother is concerned that her child has stopped seeing friends and discarded his laptop, claiming he was receiving special messages from Facebook. There is social withdrawal and odd beliefs. What is the most important mental function to assess? The most important mental function to assess is reality testing. Reality testing. Why? Beliefs of special messages and altered perception of reality suggests impaired reality testing. This patient has abnormal perception of reality, has impaired reality testing, which is an early sign of psychosis. Why the other options are incorrect? Self-esteem is relevant to depression, not delusions. So this patient is claiming that he was receiving special messages from Facebook. This is delusions. Delusions means altered perception of reality, impaired reality testing, which is an early sign of psychosis. So self-esteem is not related to delusion, it's relevant to depression. Mood doesn't explain bizarre beliefs. Bizarre beliefs. Judgment is secondary to reality distortion. Insight is assessed later after psychosis is identified. Here, this is an example of a patient with psychosis. Or this is a patient with a certain disease that is, if left untreated, will lead to psychosis. That's why any patient with signs of psychosis may need MRI of the brain. This patient is an adult, 35-year-old woman with hyperemesis gravidarum and confusion. These are the MRI images. This is Wernicke's encephalopathy. There's hyper-intense signal on flare. This is a flare image. There's hyper-intense signal on flare, T2 weighted and diffusion weighted images. Here, this is the flare image. How do I know that this is a flare image? Okay. This image is a sequence of T2. However, the fluid is attenuated. The fluid also is attenuated. Why it is a sequence of T2? Because the white matter is of low signal. The white matter is of low signal than the gray matter. When the white matter is of lower signal than the gray matter, this is T2 sequence. if also the fluid signal is attenuated, so this is flare, fluid attenuation. Here, this is the fluid signal, which is high signal. So this is the coronal T2 weighted image. This is the T1 weighted image, post contrast. This is the diffusion weighted image. So there is hyper intense signal on flare, T2 weighted, and the diffusion weighted images in the bilateral medial thalami along the walls of the third ventricle with restricted diffusion. So the hyper intense signal in Wernicke's encephalopathy will be along the bilateral medial thalami. This is the thalami, and this is the medial thalami. The bilateral medial thalami along the walls of the third ventricle. As you know, both thalami are separated by the third ventricle. So the hyperintensity is along the medial thalami, along the walls of the third ventricle or periventricular, the periventricular areas of the medial thalami, periventricular walls of the medial thalami, and it will show restricted diffusion. The periventricular wall of the medial thalami will show restricted diffusion and of high signal flare image. This is characteristic. I will show you, yeah, I think this one, no, yeah, here. These are the typical MRI finding of Wernicke's encephalopathy. As you can see here, the high signal is seen in these flare images, as I mentioned. The white matter of low signal and the fluid is attenuated. So this is flare image. Okay. Let's open it. Go back. Okay. So the high signal here is seen within the mammillary bodies, the colliculi, the medial or periventricular walls of the medial thalami, the fornix. Okay. Let's go back. Wernicke's encephalopathy is acute neurologic emergency caused by thiamine deficiency, vitamin B12. So, vitamin B12 or thiamine deficiency is the cause of Wernicke's encephalopathy. It most commonly occurs in alcoholic. So, the vitamin B12 will be deficient mostly in alcoholics, but can be found in other conditions that produce thiamine depletion, including hyperemesis gravidarum, starvation, anorexia nervosa, bariatric surgery. So alcoholics, middle age alcoholic, okay, or adult with hyperemesis gravidarum, or adolescent with anorexia nervosa, okay, or starvation, pediatric surgery. All of these can cause thiamine deficiency or thiamine depletion. This thiamine deficiency or vitamin B1 deficiency will lead to Wernicke's encephalopathy. The classic clinical presentation is confusion, ataxia, ophthalmoplegia. Confusion, ataxia, ophthalmoplegia. The most common presentation is diminished consciousness. MRI is helpful in diagnose Wernicke's encephalopathy. It will show hyperintense signal on T2 and flare images in the medial thalami, mammillary bodies, periaqueductal gray matter, and tectum. Here there is the periaqueductal gray matter. The middle image shows the periaqueductal gray matter. Okay. Sorry, it's not the first image. Shows the periaqueductal gray matter. The aqueduct of Sylvius is seen posteriorly to the midbrain. So the first image showing the high signal in the periaqueductal gray matter. And also the high signal is seen in the uppercuts along the periventricular gray matter of the medial thalami. So the uppercuts will show the periventricular gray matter of the medial thalami, hyperintensity, and the lower cuts will show the periaqueductal gray matter in the posterior aspect of the midbrain, hyperintensity. And let's go back. Involvement of the mammillary bodies, also very important. The mammillary bodies in front of the midbrain. So now again, in the uppercuts, the periventricular gray matter of the medial thalami along with the fornix anteriorly will be involved, and in the lower cuts, the periaqueductal gray matter in the posterior aspect of the midbrain along with the mammillary bodies anteriorly will be involved. Okay, the management here, this disorder is reversible in the early stages with intravenous administration of thiamine or vitamin B1. So the mainstay treatment in the early stages is intravenous administration of thiamine, and the disorder will be reversible. If Wernicke's encephalopathy is left untreated, it will lead to a kind of psychosis. It will lead to psychosis. Try to imagine that thiamine deficiency, if left untreated, it will lead to psychosis. So vitamin B1 is very important for your brain, for the health of your brain. This case is another example of psychosis. This patient has hallucinations, tremors, cognitive decline. He's a 65-year-old man. Okay. The first image here is fluorine FDG MBQ PET imaging. Fluorine FDG MBQ imaging. And this one is DET scan, or iodide loflopan DET scan, SPECT imaging. So this is SPECT imaging, DET scan, SPECT imaging, and this is PET scan. This is PET scan, and this is SPECT or DET scan. So here in this PET scan, there is bilaterally decreased metabolism in the parietal, temporal, and occipital cortices. This is the frontal, this is the parietal cortex, this is the occipital cortex, and the parietal and occipital cortex, and the temporal cortex. So there is normal metabolism, okay, of the frontal cortex bilaterally. Normal metabolism of the frontal cortex bilaterally with decreased metabolism of the parietal, occipital, and the temporal lobes bilaterally. This is seen in FDG PET scan. FDG PET scan. However, in iodine leflopan DET scan, this is iodine leflopan DET scan, this is the normal. So let's start talking about the normal first. The normal DET scan. Can you see the comma sign here of uptake, increased uptake of the caudate and putamen nuclei bilaterally. So this is the normal uptake of caudate and putamen nuclei will give the comma-shaped sign. This is abnormal and is very characteristic of Lewy body dementia. Lewy body dementia. There is decreased uptake. There is normal uptake of the caudate nuclei. However, there is decreased uptake of the putamen nuclei. Markedly decreased uptake in the putamen nuclei, preserved uptake in the caudate nuclei. This is very characteristic of Lewy body dementia. So, two can remember Lewy body dementia, okay? The frontal is preserved, the posterior is decreased. So, in FDG PET scan, fluoride FDG PET scan, the frontal lobe is preserved, however, the posterior lobes, okay, the temporal, the parietal, the occipital lobes showed decreased metabolism. The frontal here is preserved and the posterior is decreased. So in iodine leflopan SPECT image, the caudate nuclei uptake is preserved and the putamen nuclei uptake is markedly decreased. Differential diagnosis: Alzheimer's disease, unlikely given the occipital hypometabolism. Okay, so that scan is dopamine transporter imaging. iodine. Leflupain is a cocaine analog approved by FDA for the evaluation of dopamine transport. So the iodine leflupain is a cocaine analog to evaluate the dopamine transport. That is visualized in the striatum. Okay. So that scan is dopamine transporter imaging. Dopamine transporter imaging. We image the transport of dopamine by cocaine analog, which is iodine leflupain. Okay. Parkinsonian syndromes with abnormal DET scan will likely respond to dopaminergic therapy. These include Parkinson's disease, multisystem atrophy, Lewy body dementia. Okay. All of these are Parkinsonian syndromes with abnormal DET scan. These can't be distinguished from each other by DET scan. FDG PET often aids in the differential diagnosis. So the Parkinsonian syndromes, all of these syndromes, Parkinson's, progressive supranuclear palsy, multisystem atrophy, Lewy body dementia, all of these will show abnormal DET scan and can be differentiated from each other by the FDG PET scan. If the occipital lobe show hypometabolism, occipital hypometabolism, this will exclude, the occipital hypometabolism will exclude Alzheimer's disease and will confirm Lewy body dementia. Okay, again, occipital hypometabolism is a characteristic finding of Lewy body dementia and can exclude the Alzheimer's disease. The management of Lewy body dementia. The treatments are aimed to controlling the symptoms. There is no cure for Lewy body dementia. No cure for Lewy body dementia. Okay. However, here Parkinsonian syndromes with abnormal DET scan will likely respond to dopaminergic therapy. So it may respond to dopaminergic therapy, but even this dopaminergic therapy will be aimed only to control the symptoms, and there is no cure for Lewy body dementia.